CBD, or cannabidiol, is being investigated for its many benefits. CBD is the non-psychoactive compound found in hemp and other cannabis strains. Some uses are for preventing seizures in rare forms of epilepsy, reducing inflammation and as a painkiller, for its potential for autoimmunity and neurological disorders, for its potential for some mental illness, and for the reduction of nausea and increasing appetite. A single dose of 400 milligrams of CBD was linked to reduced anxiety in a brain imaging study of 10 people with seasonal affective disorder. After consuming CBD, participants experienced reduced blood flow to parts of the limbic system that are often overactive in anxiety. At the same time, blood flow to another region important for cognition and motivation, the posterior cingulate cortex, increased. In a study of 10 healthy volunteers, those who took CBD felt less anxiety after the stressful task of public speaking. In 24 patients with social anxiety, taking CBD before public speaking was linked to reduced anxiety and discomfort and also improved cognition. In a rat study, animals given CBD displayed less addictive behavior and were less likely to actively seek out morphine and heroin. In a pilot study of 24 smokers, those who received cannabidiol smoked around 40% fewer cigarettes and did not report increased cravings for nicotine. Depressed mice given CBD quickly recovered to a non-depressed emotional state. The effect was maintained over time and was as strong as standard antidepressants. CBD consumption causes reduced blood flow in the limbic system. The limbic system is a set of structures in the brain that deal with emotions and memory. The limbic system is comprised of 4 main parts: the hypothalamus, the amygdala, the thalamus, and the hippocampus. CBD reduced blood flow to the amygdala, the area of the brain that's thought to be the key component to the fear response. The hippocampus is a complex brain structure embedded deep in the temporal lobe. It has a major role in learning and memory. It's a plastic and vulnerable structure that gets damaged by a variety of stimuli. Studies have shown that it also gets affected in a variety of neurological and psychiatric disorders. CBD increases blood flow in the hippocampus. It's proposed that the hippocampus plays a critical role by forming and reconstructing relational memory representations that underlie flexible cognition and social behavior. There is mounting evidence that damage to the hippocampus can produce inflexible and maladaptive behavior. When such behavior places high demands on the generation, recombination, and flexible use of information. This is seen in abilities as diverse as memory, navigation, exploration, imagination, creativity, decision-making, character judgments, establishing and maintaining social bonds, empathy, social discourse, and language use. Thus, the hippocampus, together with its extensive interconnections with other neural systems, supports the flexible use of information in general. It's also suggested that this understanding has important clinical implications. Hippocampal abnormalities can produce profound deficits in real-world situations, which typically place high demands on the flexible use of information, but are not always obvious on diagnostic tools tuned to frontal lobe function. So simplified, all sorts of mental health problems may partly be due to improper blood flow to the hippocampus, and by correcting this with CBD, It may provide a new line of treatment for previously untreatable conditions. Numerous companies are selling overpriced CBD olive oil tinctures. Some of these can be from 4 to 10 times more expensive than purchasing pure CBD isolate crystals. For the high doses of 200 to 400 milligrams per day, which are used in the studies, then CBD isolate crystals would be the most cost-effective option. For further information on new treatments for increasing cognition, for post-traumatic stress disorder, anxiety, depression, and other mental health disorders, see my other videos. 1. Novel treatment and research for PTSD, social anxiety, and generalized anxiety disorders discusses picamilin, amoxicillin, lithium orotate, aniracetam, and various choline sources. Also, watch out for more videos about the other benefits of CBD.